Hey, Danny Matta here, founder of PT Biz. And today we're going to talk about why are so many clinicians moving towards the cashpt model. This comes off of conversations I've had recently. I would say in the last couple of weeks, I've had more conversations with professors, people within the PT kind of space from a standpoint of the housing bodies of our profession and practice owners in bigger in-network clinics. That it's been interesting to kind of see their perspective on the profession. And I had one of the people that I talked to ask me a question that I thought was interesting. And it was, why do you think there's so many people moving the cash direction? And this is somebody that is also, in the education space, so a professor, and they see the same trend that I do. I have been speaking to universities, PT programs for 7 years now. And 7 years ago, it was odd to have anybody interested in cash-based physical therapy at all. And now, when I speak to universities, I have way more interest, like multiples more interest in people wanting to go this route at some point in time in their career. And, it got me thinking, and this is not necessarily super structured, but it's something that for the last few days, I've just been kind of thinking about where the profession is going and why we're seeing so much of this. And it seems so obvious to me, to be honest. It seems so obvious that once people are out of school for a couple years, that the job that we're promised is not what you end up in. It's not what you thought your life was going to look like. And for a lot of us, we start to realize that in our first clinical rotation. Maybe it's one of the clinical rotations that you do. You end up in a higher volume clinic, working with populations that you don't find as all that interesting. And you wonder if you made the right decision, but it's kind of too late by that point. You're already about to graduate. You've already taken on a massive amount of debt. So, you go ahead, finish it out, get a job, and start working. And it's like this desire to really become a great clinician starts to slowly fizzle away. It's like watching a fire go out. And it is frustrating and sad at the same time. I don't even know how many clinicians I've talked to that are 2 to 3 years out that are really even questioning whether they should still be in the profession. And I don't have an answer for this. Let me caveat this by saying I don't have a solution to this problem. So I feel almost, like this is a waste talking about it. But I hope that this resonates with some of you because you may be feeling like this, or maybe you have, and I know that I did. And it's because the setup that we have, the volume that we have to see, the documentation, the administrative burden, the inability to take time off. I literally couldn't go to family events because I wasn't allowed to take time off when I was an intern, when I was seeing patients as a military PT. Like, I remember not being able to go to important family events because I couldn't leave our patient schedules, right? Like, I get it. They're very restrictive. And it's a challenge on people's work-life balance. So the reason that I see so many people move the direction of a cash-based clinic is because once they're a couple years in, I think you come to a crossroad and you say to yourself, I'm either going to leave the profession or I'm going to figure out how to use my skill set in a slightly different way. And starting an in-network clinic doesn't really seem like it makes that much sense to most people because they're trying to leave that environment. Like, they're frustrated in that environment, right? And what they want to do is they want to work with patients in a more direct manner. They want to see fewer people. They want to make a little bit more money. So when they look for options, they start to see, oh, this makes sense to me. This could work. It's the same internal monologue that I had when I was trying to figure out what I was going to do when I got out of the Army. I sure as hell knew I did not want to touch insurance because I didn't know the first thing about it. We don't deal with insurance in the military, whatever. It's just nothing I ever learned about. I had experienced working in a high volume clinic as an intern for a year, and I didn't really enjoy it. I didn't want to go back to doing that. And I didn't have any other options. Like it was either that or, I just was going to do something different. And for me, the compromise of being able to see fewer people, being able to have say over my time, being able to have complete say over my time, which in some cases is a fallacy when you start your own business, by the way, because it's not like I worked less, I worked more. I could decide if I wanted to take time off, but I was definitely working more than I was when I was working at another clinic. But at least I could say when I want to do that. At least if I want to take my kids to school, I could decide to do that. I could change my schedule around, and I was the one that had say over that. And that was very valuable to me. And I definitely was able to make more money than I was working somewhere else. So the trade-off, it seemed like it made a lot of sense to me. It seemed like an elegant solution to the problem that I had, where I could still stay in the profession, I could see fewer people, I could make more money, and I could have say over my time. So when people ask me, like, why are people going this direction? I kind of think to myself, what other option do they have? What other option allows them to still stay in the profession, but be able to have these other things that they would like to have from a job that they really love? Like, keep in mind, like, most physical therapists really, really get a lot of personal satisfaction out of helping patients get over injuries and back to things they like to do. It is one of the most personally rewarding things I've ever experienced in my life. It's fantastic. And if you feel the same way, seeing people in a high volume clinic where you barely get any time to actually work with people and do more advanced things and listen to somebody during evals is frustrating to you. And that's what makes us feel burnt out, not even to mention the documentation side that we have to deal with. So in order to have this compromise, we also have to compromise on something else, which I always had a hard time with. I had to exclude certain populations. I couldn't see Medicare. I couldn't see Medicaid. Certain demographics could not afford to work with me. And that is a trade-off that we have to make in order to move fully to a cash-based clinic. And I will say, as your business grows, at least in the populations that can't afford to work with you, you can work with people for free in pro bono work. And we did plenty of that. And it was something that having a successful business allowed us to work with underprivileged kids that there's no way they would be able to work with us, kids that come from refugee camps. And that is stuff that you can do with a successful business. You can't do that if you don't have the resources to be able to work with someone for free. And that is a drawback to a cash-based clinic. But if I think of what other options they have, I don't see a whole lot that makes sense. And it's a shame to see fantastic clinicians move to become a realtor, a salesperson, in other roles in tech companies and things that they may not want to do, but it aligns with what they want their life to do more. Because we're losing fantastic clinicians that are young, that should eventually move into mentorship roles and leadership roles within our profession and make it better. And they're leaving. So it's challenging when I think about it. And when I think about this question of why people are doing it, it's just like, why would anybody stay in a shitty high volume clinic job that actually gives a fuck about their patients and wants to be able to control their schedule and wants to make a little bit more money and not leave the profession? You give us no choice. None. And the worst part about it is they don't have much of a choice either. So I can't even get that mad at high volume clinics that are driving this necessary volume, because if you really look at the numbers on it, the vast majority of them they got to see a certain amount of patients to pay their bills. I'm not talking about like giant ones that are obviously, private equity owned, or they have hospital contracts, or maybe they have these unfair negotiation opportunities. I'm talking about the vast majority of higher volume, smaller in-network clinics. They don't have much of a choice. and it sucks for them too, but I don't know what the answer is because I can't fix the insurance. I can't fix insurance in the US, but in your own life, you have to make a choice of what you want to do. And either way, you're going to have to make compromises. There's no perfect solution for what you can do. And what's important is for you to get very clear on what you want your life to look like, and then pick the option, pick the vehicle that gets you as close to that as you possibly can. And for me, that meant a cash-based practice was the thing that made the most sense for me. And honestly, it is hands down one of the best career decisions that I ever made, because it did lead me to be very much reinvigorated to work with people to find this passion and desire to become a great clinician and really help my clients and to get that back, and I feel like we lose that after a couple of years of being beat down by volume and the administrative burden of what we do on a daily basis. And I feel like a lot of people have done the same thing, and a lot of people have gotten that desire back and that energy and that passion for the profession by doing the same thing. So I think net, it's a positive, and it's a great thing to see. And I think you're going to see more of it because I don't think there's a lot of great options out there. I don't see the trend changing anytime soon. I don't see the, insurance regulation changing in a meaningful way that's going to, create a better opportunity for people to be able to accept insurance and not have to take $70 contracts per session. And you just can't run a business off of that in a low volume setting. You just can't, so it is what it is, but that's the problem. And the problem is complex, it's tricky, but in the end, I think you have to really get clear on what you want. And that's the most important thing. You have to get clear on what you want. And maybe what you want is to not be a physical therapist. Who knows? You might have literally been 22 years old when you decided that you were going to physical therapy school and you didn't know shit about the world or what you wanted to do with your life. And now you do. And now you're going to make a career change. And I'll tell you this much, if that is you, what a fantastic foundation of skills you've developed. I've seen many clinicians move outside of the PT space and be absolutely so successful in other areas because you are a fantastic communicator. You're a natural problem solver. You can multitask. You typically are very high emotional intelligence. You can really do well with people. You're great at being detail oriented because you have to document shit all the time. You know a lot. And you've also passed a lot of hard tests. You're going to be fine if you go and do something else. But if you don't want to actually do something else, if you actually want to be a clinician, you got to make a decision about what the right path is for you. And the cash-based clinic might be that solution. And it was for me. So anyway, I'll get off my soapbox. There really wasn't a point to this as organized as I usually do, but I want to share this with you because I think it's something that might be going through many of your, your minds, your thoughts of what to do. And if you've already made the decision to go that direction, I bet you thought these same things too. And when somebody asks you why people are doing it, you probably think, why would they not? Like, what other option do they have? That's the way that I felt. So anyway, thank you so much for listening and watching. As always, I appreciate y'all, and I'll catch you in the next one.